Hello, everyone. My name is Glenn Tallman. I'm the Chief Executive Officer of Transcarent, and I'm here today with two distinguished guests. Pat Garrity is President and CEO of GuideWell and Florida Blue, and is a longtime innovator in the healthcare space and a longtime acknowledged leader in this space. And also joining us is Jonathan Perlin. Jonathan is President of Clinical Operations and Chief Medical Officer of HCA. However, some breaking news: as of March 1st, he will become the 7th President of the Joint Commission. Jonathan's also served as Undersecretary for the Department of Veterans Affairs, so he brings a very broad purview of the topic that we'll be discussing today. And that topic is actually misinformation in healthcare. And I believe many of you, if you're on this webcast today, you've already read the background of that, but we're dealing with an increasingly pressing topic of how do we communicate information that's going to lead to better care, while at the same time getting people to trust that information and trust the sources of that information. So let's go ahead and begin today. And first, I'll say a quick hello and welcome to Pat and to Jonathan. Welcome to both of you.
Thank you, Glenn. Happy to be here.
And thanks, Glenn. And Pat, it's great to be with both of you.
Yeah. Great. Well, I'm looking forward to some interesting and enlightening discussion. And why don't we go ahead and start with the first question, which is really what I already paraphrased, and that is, as healthcare leaders, how in fact do we combat this increasingly challenging problem that we have of mistrust and misinformation that's really standing in the way of better care? So maybe, Jonathan, why don't you go ahead and get us started on that? It's a challenge that everybody in the industry is facing today.
This is such a critical issue, Glenn, and I think it's fair to say that regardless of politics, the current situation with COVID has been one that created differences of opinion. Some of those opinions based in what clinicians and scientists would view as fact, and others not. And we know we live in a very technologically enabled environment where information can be amplified and rapidly disseminated, but so too can disinformation. And we need to be able to understand that the information we receive, particularly around critical and life-threatening or life-saving health issues, is really good information. When you buy a car, you want to know that that 5-star collision rating for a head-on accident really means that you're apt to have a better chance of survival. You want to know that a place that's rated 5 stars for heart surgery is really good. And similarly, we need to know that the information we receive that makes recommendations about what we should and shouldn't do is really credible. But the problem is there's no arbiter. And I wonder if there should be some mechanism for the rating of information, an underwriter's laboratory that makes it easier for even me as a clinician, but my mother as a patient to look at something and say, hey, this has an underwriter's laboratory equivalent endorsement that says this is good information. And you might ask, what kind of criteria would that use? Well, the U.S. Preventive Services Task Force, assesses all sorts of evidence. And they have algorithms for assessing what's really strong evidence and what's weaker evidence, so that you can actually put a grade on the evidence. And so that when my mom goes to check out a health fact, she knows that this is A-level evidence or this is much weaker evidence. I'd be interested in Pat's thought, because they make so many important policy decisions around just this issue.
Well, thanks, Jonathan. And I agree with you. It really would simplify things. In the absence of that, we've had to rely on the trusted sources like the FDA, like NIH, like the CDC, like the American Academy of Pediatrics when we're talking about the pediatric vaccination. So we go to the source, the most credible source that applies to the issue that we're talking about. but we've been very careful to make sure that the voices that are connecting with our members are trusted by our members. So, for instance, we've recruited pastors and asked them to help us with the message. We've recruited community leaders. When we are talking the message from our organization, we're very mindful of which leaders are talking to which communities so that there's a trust, a respect, an understanding that this individual is operating in the best interest of the member who is trying to sort through what is a complicated set of ever-changing guidelines related to the pandemic over the last 2 years. There have been lots of different positions that have evolved. So it is critical that we're using the right scientific sources and then the right messengers.
Well, first of all, Jonathan, thank you. I think you've just given me an idea for another new business, and that is Consumer Reports for Health. So I appreciate that. And of course, your work, your upcoming role at the Joint Commission, that has been a body that has been able to, in a very non-political way, provide feedback to the industry. So I think there's room for that. Pat, I love what you said, because you talked about not just the information, but how we communicate it. And that may be multilingual, that may be very different for different kinds of populations, and who it comes from. Clearly, we've done that. But let me talk about a different way of communicating, and that's using technology. And Pat, maybe we'll start with you. How do you think technology has either helped or hindered your ability? I mean, the Blues have been known for ages as a trusted source of information and a great place to go to get your health care. And yet today, more and more of that information is coming from the internet and other sources. So how are you using technology, and everything being equal, positive, negative, or it doesn't matter, it's here and you've got to deal with it?
Well, Glenn, I look at technology as a positive. And I think, looking back at the way you've become a trusted resource for folks is spending too much time in the past. So we actually look forward and look to how do we connect with people where they are. And if you think about what people as consumers are doing in their everyday life, they're getting information about the products they're buying, about the programs they watch, about how they're going to spend their leisure time. They're getting all of that online. And so to be resistant to that would be foolish. So we've tried to engage technology and really get on the leading edge of thinking about how do we work with our members to give them what they need in the most convenient and digital ways. So literally everything you can do with our company, you can do in a digital format today. And much of that has come from partnering with our members to make sure that we are hitting the stride that they expect from us in terms of digital interface, and making sure that we're doing that as personalized as we can. So it's not a matter of just turning it over to some other source and looking at that as a third party, but it's really being engaged in a very personal way and making sure that the programs we're bringing to people are resonating with them, whether that's behavioral health or whether that's diabetes management, which we do with a company you may have some familiarity with, used to be known as Livongo, did something with Teladoc. We're one of their big customers, and that's been really important to us. Or maybe it's through a service like Transcarent that's advising people for what place they ought to be getting their care for the most efficient and effective care. All programs that we're very interested in and making sure we're bringing value to our customers.
Well, thanks for the shout out. I want to follow up in one respect. So you've talked about the digital piece, but you've also done something that went against the trend, and that is you actually started to put centers in local areas. Maybe talk a little bit about that, because we understand this idea of clicks and mortar, and there's been this almost overemphasis on digital is going to solve it all. So maybe talk about your thinking there for a moment before I head back to Jonathan for the same question.
Sure, happy to do that. You know, Glenn, I've always felt like our movement forward or innovation has to be in two different realms. One that has a really personal touch to it and one that has the technology touch to it. And if you look at what Apple has done, I think their stores are relatively popular, even though they're bricks and mortar. We were following something of that model, if you will, because we knew we had customers who, because they couldn't really access their health insurance the way they wanted to, that we would put a face on our organization. So across Florida, there are more than 30 retail centers where you can talk to somebody either to do your claims, to have some clinical advice, or have a health and wellness plan designed for you, buy product. We do lots of different things in those centers, and they're wildly popular with our members. It's been a great dovetail with the ACA. And so we've had tremendous growth and tremendous retention of members because of what we've done there. But it also gives us an opportunity to do a warm transfer. So people don't always move to technology unless they've been introduced to it. And we can do that in our centers, and it's a very helpful way to help members pick up the new ways of engaging us.
Well, and I love that. I haven't heard you use the example of Apple, but it's about as good an example as you can get, which is, hey, this high-tech company is building stores. And initially, everybody said, what are they doing? They're going to lose their shirts. And I think we saw the opposite. It was a complete compliment. So I compliment you on that. Jonathan, you're the largest in your space. You have hospitals all over the country. And tell us a little bit about your plans to incorporate both the digital realm, and do you see that as positive? You've always used the technology in your facilities, but how do you outreach with that?
Yeah, I think we start with a great advantage in HCA Healthcare. Among the 6 most trusted professions are doctors, nurses, and pharmacists. And Pat is absolutely right that you have to have both the high tech and the high touch. I think we all appreciate that the pandemic accelerated what was already a trajectory. But while I expected that my graduate student age daughter would be quite comfortable with a telehealth visit, I wasn't so sure that my octogenarian parents would be as comfortable. And in fact, they adapted very quickly. But it's really the complement of the tech and the touch, because the relationship is really needs to have some degree of continuity. We, I think, surprised ourselves at how quickly we pivoted to really the use of telehealth. But I think the lesson really drives home Pat's point, which is that after people became more comfortable coming back for physical sites of care, outside of just extreme emergency needs, they wanted those technologies to augment their relationship to healthcare, not replace their relationship to actual human beings. And so we see that as part of the environment. Now, I think the broader piece gets back to this notion of evidence and truth, which is, how do we know what's best for any particular patient on any given day? And one of the things I'm most proud of in our environment is that we've essentially created a learning health system. Too much of healthcare is practiced as 51st dates, where every encounter is novel. 12 years ago, we made a decision that the opportunity with meaningful use wasn't to rip and replace one legacy electronic record with a slightly prettier, but in fact, to build an ecosystem that would support advanced tools, such as the type that General Catalyst and others with whom we're partnering, Cumura, can tap into, but in fact have a sort of central nervous system that the data from all of those clinical encounters go to, so that we can look at patterns and know what's best for the particular patient at the particular moment, anticipate needs, not just react to needs, and improve the system with every turn of what is a virtuous cycle. And so that learning health system is actually not only a capacity to build a collective memory where we can not only use the best evidence, but through the natural variation that occurs, find out what is tomorrow's best practice, not standardized toward yesterday's. And then, because we have an interoperability concept, can partner with functions such as those that Pat just described in terms of the Livongo type of activity, partner with what we're working on specifically with General Catalysts, Kimura, advancing Patient Keeper, which is a very friendly clinician portal that makes it easy to keep the sort of cognitive arc of care intact while extracting the essential information and really meeting the patient's needs in real time while simultaneously reducing the burden to clinicians. We're pretty excited about this ability to bring the high tech and high touch together, not just for the patient, but for caregivers who frankly are extremely burdened, not in any sort of onerous way, but the reality of COVID is that it's placed a lot of stress on the healthcare system, on the caregivers themselves. And so if we can lighten their load with better technologies, decision aids that simultaneously improve the capacity to give better care, support better evidence, learn more quickly, and really do what the clinicians love, which is engage in the interpersonal relationship, whether in person or through a digital interface, then it's really a home run.
And
Glenn,
you mentioned, yeah, please
just add a data point. Yeah, if I could just add a data point, you know, in our marketplace, we have over 1 million people that are in the ACA with us, and the retention levels are extraordinarily high. And it's proof positive that the high touch, high tech combination can actually work for you. If we look at our company a decade ago, we were B2B. Now, more than half our revenue comes in B2C. And so that transformation has been absolutely critical. And it really has been the balance of high touch and high tech that has made that happen. You go to our retail centers, our satisfaction levels are well into the 90s if you engage us face to face. So there really is something there, and our members are telling us that.
Well, and I think part of the reason that both of you are on today is because you have been driving innovation in your respective areas. And Jonathan, let me go back. You mentioned General Catalyst, which for our listeners who may not know, General Catalyst is probably at least today, the leading venture firm in Silicon Valley in terms of innovation and successes. And HCA has done this innovative partnership with General Catalyst. And you mentioned Kimura, and maybe talk a little bit about what you expect to get from them and why you've decided to do that.
Well, we believe that partnerships offer an extraordinary opportunity to accelerate value, to accelerate by tapping into what are the strengths of each partner and create true synergy. We bring more experience into direct caregiving than any other singular organization. We have the privilege of over 35 million patient encounters annually. And we have a digital record of them. Kimura, which is a part of General Catalyst, will allow us to take the technology I mentioned a moment ago, Patient Keeper, and really accelerate it in a way that would outstrip what we would be able to do by ourselves. We believe we can provide insights into workflow and a laboratory for rapid iterative testing and development such that this product can be truly exceptional. And, you know, I mentioned before this concept of a learning health system, this platform. It really is one that I think General Kimura's, remarkable founder and CEO, Hamad Taneja, really articulated so well in his book Unscaled, the notion that when you put together, data science and AI with cloud computing and, technologies such as social network, you have this new platform capacity. And if you take the ingredients that our two organizations put together, we can tap into that new platform capacity to develop mechanisms to provide care, better care to patients, better care to populations, better support to providers, more efficiently delivered, while at the same time sort of, creating a platform for discovery. And, what could be better than that? So we're really excited about this partnership with Kimura. While I won't be here because I'm going to the Joint Commission, I just wish I could see this future because I can already project that this will be revolutionary.
So what I hear you both saying is using technology to kind of amplify both the physical and the personalization of the relationship that you have with all the people using your system. So along those lines, how do you become more closely embedded in the communities you serve as you get bigger? Because both of you run very large organizations. We're depending on both of you to be successful to deliver the kind of health and care that we want in the future. How do you do that? And how do you particularly drive that to underserved communities that we've heard so much about, particularly during this COVID pandemic? Pat, maybe take a shot at that first.
Sure. Glenn, even as we've gotten bigger, we've gotten more hyper-local. So in Florida, we subdivided the state into 4 regions. Now we subdivided into 9 regions, getting even closer to the communities that we serve. One of the activities we ran out of our innovation center was an innovation challenge to address the issue of food security. We had 54 submissions to a contest from around the state by people who were doing the work at the community level, looking at nutrition, looking at food deserts and all of the different challenges in this space. But rather than say, hey, we have the answer and we're here to help, we said, let's frame the question and then let's ask the community to come forward. So these 54 ideas then were judged by a third-party objective judging panel, but we brought all of those folks together at our innovation center just outside of Orlando. They then became a community that now is much more connected to each other. So real value from the connection alone. And then we funded the best idea coming out of that set of ideas that were contributed. So it was a great way to endorse what's happening at that local level. We've done the same thing on our Equity Alliance Challenge, where we've said we want to advance the way we all look at health equity. And we're unleashing all of the great ideas that are happening around our communities across our state to really invest in those ideas, to partner with people. And the answers are different in the different communities, but they're so empowered by the idea that the idea came out of the community, the work is framed in the community, and we're coming to amplify it, to help tell the story, to put funds in, and to make that grow. And it really has been very powerful for our organization to be that connected across all of the different communities we're serving.
And Jonathan, from your perspective, again, you operate very broadly, and these are big physical facilities, but how do you connect them, particularly from a social equity standpoint? I know you're already delivering, you're providing free care in places and you're serving the community in that way. What can you give us some sense of how you're thinking about that as an organization?
Well, COVID certainly has sharpened the focus for all healthcare providers, payers alike, in terms of redressing what was always unacceptable because it clearly is intolerable. And I'll just tell you that personally had an epiphany, always thought of safety as the foundation for excellence in healthcare. But you can't get to safety unless you start with equity. Thanks for mentioning our access, because at less than 400% of poverty level, we're heavily discounted, and less than 200% we're free. We relieve all bills, and it's really a model approach. But really, the opportunity is to examine health in communities through the lens of the illnesses that patients present with when they come to our care. What we know in the United States is that there are great disparities. For example, African-American women experience a 400% greater risk for mortality than white women. Latina women experience 150% greater risk for maternal mortality. Unacceptable. I'm pleased to say, by working with community through partnerships In 2019, 2018, there were actually no deaths in women of color, despite nearly 250,000 deliveries in each of those years. Now, I do have to put an asterisk on 2020, because in 2020 and going on today, we've had a spike in maternal mortality, and it's unvaccinated women, regardless of demography, who have terminal COVID at the point of delivery. And so, this opens for us a new lens of partnering, as Pat said, community organizations with religious organizations and social organizations to really help understand how we can achieve those things that are ultimately life-saving, as in this instance, vaccination. There's, the topic of our conversation, misinformation about the safety of vaccines in pregnancy. The data are that it saves lives. This is sort of the lens that we use as we look systematically at all of our data and say, okay, we know these are national disparities. How does HCA Healthcare do? And in some areas like maternal mortality, we set the bar. And this is really what I meant about using that learning health system capacity, because we used that capacity to understand what the causes of death were. And they were really threefold. They were uncontrolled blood pressure in pregnancy, preeclampsia, postpartum hemorrhage, which can be avoided, as well as clots that become pulmonary emboli and lead to death, but only in women with C-section. So we have strategic protocols that underlie the basis of the national protocols developed in HCA Healthcare that systematically cut death, but also systematically eradicated an unacceptable, intolerable disparity. So it's a learning cycle, and one that increasingly we partner at the national level for issues that are bigger than HCA Healthcare alone, of which there are many, but importantly, partner, as Pat said, at the hyper-local level to get into communities and really work on those things that are part of the combination of community and the former healthcare system. For example, prenatal care.
Well, you bring up kind of where we started, and that was this topic of misinformation. How do you both, I'd be interested in two things. One, we know as we think about COVID and the pandemic in general, the terrible loss of life, we know about that. We know the economic issues. And frankly, I don't think we focused enough on the behavioral health long-term issues that are coming up. How do you both see your organizations focusing on both behavioral health as one of the precursors to staying healthy and keeping your populations healthy? And what kinds of new programs will you be introducing, both digital and more physically oriented, to address these issues? Because I think 10 years from now, that will be the one remaining piece that we'll be dealing with from a health and wellness standpoint. So Pat, maybe jump in on that if you would.
Sure. Thanks, Glenn. We view ourselves, while we do insurance, we view ourselves as a health solutions company, insurance just being a piece of that, and behavioral health being a very important component. So last year, we bought the New Directions behavioral health company. We're the majority owner of that organization. And we did that with a real sharp eye on what was happening in the pandemic and wanted to be prepared for what was going to come post the pandemic. And obviously, people are having much more acute behavioral health conditions as a result of all the different elements of the pandemic. And so that was a very important acquisition for us. We see it now as the time is ripe for the integration of behavioral and physical health. They really have interplayed with each other for years. The industry has sort of left them in two separate buckets. Bringing them together is absolutely vital. And we saw lots of digital behavioral health that was happening during the pandemic. That was one of the things that was very obvious, is that people who had an established relationship were extraordinarily comfortable with being remote with their therapist. And so that one is going to carry on for sure. Getting people into that initial visit is one that still takes a little bit of work, but we know that, it's still a place where we're all fighting against stigma. And that's an important part of getting the behavioral health out in the community that we need. But it's about education. It's about demonstrating what can be done. It's connecting to primary care physicians. Most of the country has a shortage of people who actually can do the initial workups, and primary care physicians are often the first to see the red flags of behavioral health conditions. And so it's bringing that data to the primary care physician and making it an easy transition that will be very important as we go forward.
And Jonathan, thoughts on that same topic?
Yeah, we have the privilege of being one of the largest mental health providers in the country. And the lesson that I learned in my VA days running the VA is that there's no physical health without mental health and no mental health without physical health. If you have serious mental illness, you have a 50% greater chance of serious chronic medical illnesses. And if you have serious chronic medical illnesses, you have a third greater chance of having depression or other mental illnesses. So these have to go together. This has been exacerbated by COVID. We see this in the substance use epidemic. I have the privilege of co-chairing the National Academy of Medicine's Action Collaborative addressing the U.S. opioid epidemic. And sadly, despite the work that's been done, the death from opioid overdoses increased last year with the isolation and the breakdown of connections. So whether it's technology or in-person human interaction, whether it's lay individuals or whether it's primary care, we need to better integrate and bring those resources to the community. In HCA Healthcare, we're doing our part by introducing programs to systematically reduce, if not eliminate, the use of opioids. And enhanced surgical recovery is one that leads not only to a better outcome for the patient, easier recovery, where we feed the patient before, give them fluids, things that were absolutely antithetical to what we were taught at the time I was going to medical school, and it reduces their need for pain. And in the process, we've cut the need for opioids by 1/3. Finally, as much as this is a general population issue, nurses, doctors, respiratory therapists have seen roughly 6 times the rate of death in healthcare during the COVID pandemic than at other times. This is a challenging moment. And so part of this is also providing good mental health support, good resilience training to healthcare providers. And I know that I join with both of you in a collective shout out to those individuals who are at the very front lines of care in communities and hospitals, organizing from the payer side, but bringing together our collective forces. We owe those individuals just an incredible gratitude for what they do each and every day.
Well, and that is a great kind of thought to conclude on. One, to thank, all of the caregivers, our physicians, our nurses, all of the associated caregivers, the people running our great facilities like HCA, the people providing, the great services and support and insurance like the folks at Florida Blue and Guidewell. And, I believe that healthcare is largely an information business because that's where it starts and that's where it ends. We have to communicate clearly the information that people trust from credible sources, and then based on that, allow people to make better decisions. It's a part of the founding of Transcarent, which was unbiased information, trusted guidance, and then easy access to valued care. So that tenet is really where we started the business. But today, I want to thank both of you. Your leadership has really been critical in this industry. And the only thing that I would put above that information is the leadership that gets us there. You two are perfect examples of that leadership. So thank you both. Thanks to Emids for having us today. And again, we'll look forward to doing this again. And Jonathan, best of luck in your new role that's coming up. We'll look forward to watching you succeed there as well. Thanks, everyone. Thanks so much.
Thank you, Glenn. Thanks, Jonathan.
Thank you. Thank you very much.